All right, everybody, let's go. Welcome, welcome. Welcome, everybody in the room. Welcome to the folks online. We are streaming. If anybody in the room wants to see what the folks online are seeing, you've got 15 to 20 screens of my face that you can see what's going on online. Thank you, everybody, for joining us today. Quick reminder, please mute your devices before the presentations. This portion of the event today, this is going to be human-centered, our annual symposium showcasing the work of the medical students in the Scholarly Inquiry Design program at Sidney Kimmel Medical College. And then that will be followed by an in-person only session and a presentation by our SI Humanities program students who are here sharing this room with us today, which is really cool. First time we're presenting together, and who knows, maybe there'll be some interesting collaborative efforts that come from this. So I hope everybody pays attention to what your fellow students are working on. I'll speak on behalf of everybody in the design track, and I know my colleagues in the humanities track feel the same. Really proud of our students and the unique and exciting work that they're doing here in medical school, and that they've taken on alongside an extremely challenging medical school curriculum. So a lot of what our students do is really driven by their own talent, their skills, and their passion ultimately for improving the world around them. And every time we have one of these, it makes me really excited because it recharges all my batteries, getting to see that, these future leaders are really paving the way and getting this experience so that when they're out there in the world and they have control over things, that they'll be making really great decisions in a really smart way. So commend all of the students in both tracks for your decisions to do this work. And you should be commending yourselves as well for a job well done. So first, thank you to all of the students in our class. This is the Sidney Kimmel Medical College class of 2027. These are students in their second year of medical school. Thank you to our track coordinators. Personally, I want to thank Mary Ellen Daly, who's standing right next to me here, for all of the work that she does to absolutely kill it with everything as far as coordinating the work in the design track. Thank you to our mentors and advisors in the design program, to the SI leadership team, and everyone here today for supporting the work that we do. So here's how it's going to go. We in the design track, so this is for the first part of the day, we have 6 teams we'll be presenting to you today. Each team will be given 5 minutes each to do their presentations, and questions will be reserved for an in-person only Q&A session at the end following the humanities presentation. So for those online, if you see something you have a question about, you can just email me. I'm pretty easy to find. So without further ado, I am going to invite our first student up to the podium to give her presentation on her work with neurosurgical phantoms.
Just one quick announcement. Everybody has bingo cards. So you're going to use the first portion of the bingo cards. So you're paying attention to the presentations to find things on your bingo cards. When the design is all done, the design students are going to put theirs in the bucket marked DES. Hume students are going to put theirs in the bucket marked HUM, and we're going to have a drawing. And then when we do the second portion, we'll do the same exact thing. So we're starting with the first portion bingo cards, and we have some surprises for you to choose from. Okay, thank you. They're at the front desk as soon as you come in. Athena?
First up, I'll give you some good instructions, all right? Here's your clicker for your slides, okay? Should advance everything for you. So remember to hold the mic up close to your mouth and try to keep it in generally the same, okay?
Okay.
Thank you.
Hi, guys. I did a project on development and validation of a 3D printed phantom for assessing safety for SEG electrodes and MRIs. So a little bit of background. Okay, so basically for a lot of patients who have seizures, what they'll get done is this procedure called an SEEG. And what this will do is electrically map where the signals and where the seizures are coming from in the brain. And then to accurately, for the surgeons to go in and ablate those exact areas, they need to do an MRI to map out exactly where it is. And so when they would do that, previously, they would do it with the electrodes still on the head. So the ones that were generating the most signal and currency they could find. However, when you put an electrode into an MRI machine, It poses a lot of dangers like overheating. That's a big one. Overheating in the patient's brain in the MRI machine, as well as creating electrical currents. And so what we wanted to do for our project was we wanted to kind of see if there was a model we could make where we could run these tests in a controlled environment before actually doing it in the patients to better assess like the safety of the procedure. I don't know if this is working. Okay, yeah, so this is like a better image of what it kind of looks like when the patients with the electrodes in the brain would go into an MRI machine. You'd be able to see exactly where the electrodes were, and then the ones that were generating the most signal, you would just be able to know exactly where to do the surgery. And so this is what they were doing for a long time and here at Jefferson. And then they kind of were like, wait, this isn't really safe. So what we're doing is running these exact same experiments, but in a gel instead of the actual human head. And so we wanted to design something where we could like kind of make a holder for the electrodes in the phantom gel to accurately mimic like what a human brain would be like when going through the MRI machine with these electrodes in. Yeah, so like in designing it, we just wanted something that was stable, something that was compatible, and something that like would allow for different configurations of these electrode placements. So just to walk through like my design process, we started out with a lot of sketches of the 3D print that we were going for. So we started out with like a door hinge model, and then we kind of switched to something more basic with a grid plate like this. And then, so we ended up with a design that was like 6 slots and 6 grid plates in those slots, which will then be submerged like into a gel to mimic like the human brain. And then what we were able to do is go and use AutoCAD to 3D print that grid thing over there. So it's kind of crazy that that's what's going to be used to mimic like the human brain. But that's what the electrodes for the SEEGs will be placed in. And then it'll all be submerged in a gel and then placed into an MRI machine and run as if it were a patient. And then with that, we're going to see like, okay, what are the heating points? How does the heating change depending on what configurations the electrodes are placed? And are there any electrical currents, like new electrical currents that could be dangerous for the brain that we can find on the gel? So yeah, that's that. So this is kind of like an overview of the process that we went through. So the problem was that there are over 10,000 SEEG procedures that are performed annually worldwide. And so imaging safety protocols need to be kind of written up for these procedures because there haven't been any in the past. And so we started by prototyping. And if you can see the box, the acrylic box, that's like the human body prototype. And then the cardboard inside was our prototype of our electrode holder, which acts as like the human brain. And then on the far left, you can see our 3D prints, and that's what will be replace the cardboard prototype for the experiments. And wrong way. That's it. Thank you.
All right, thank you. Next up, we have Team Commodore.
Hi, everyone. We're the Commodore team, and we're really excited to present to you what we call a new era of bedside toileting.
Meet Cindy. She lives in Philadelphia, works as a medical assistant, and has a very active social life. Between busy moments, she uses the bathroom 6 to 7 times a day, as most of us do. It was never something she gave much thought. One day, while she was out walking her dog, she was tragically hit by a car. She was rushed to the hospital and unfortunately underwent an above-the-knee amputation. Among many things Cindy had to relearn after her amputation, one of them was toileting. She used a bedpan for 1 month while she was immobilized in the hospital. She then spent 2 months in a rehab facility where she learned how to use a bedside commode with the help of an occupational therapist. She was very motivated to transition away from using a bedpan. When she was finally ready to go home, Cindy was discharged with the standard issue commode, which was covered by insurance.
Cindy is one of thousands of long-term commode users, including the elderly, stroke survivors, and CNS injury patients. To learn more about their challenges, we spoke with commode users, caregivers, and healthcare providers to identify 6 key areas where current commodes fall short. Stability. Many commode users fear tipping backwards and can't trust the commode to support their body weight, especially during a transfer. Accessibility. Most commodes have restrictive armrests that prevent users from transferring from the side. Comfort. Most commodes are made with hard or cheap materials that can cause skin wounds. Wiping. A tiny seat and narrow armrests make it challenging for users and caregivers to wipe. Users may have to shift their balance to reach the toilet paper or other supplies. Maintenance. The bucket comes with a loose-fitting lid that offers almost no security. And finally, aesthetics. Bedside commodes don't look like furniture that belong in a person's home. Some users are embarrassed of their commode and cover it before having guests over. In short, commodes that are good enough simply aren't enough. People with mobility impairments need better options. It's time for a paradigm shift. Home healthcare products must evolve beyond the bare minimum to embrace safety, comfort, and dignity. Introducing Commodore, a reimagined bedside commode that changes the game in terms of safety, comfort, and dignity during bedside toileting. It's the first bedside commode designed with the user in mind. We integrated ergonomics, smooth surfaces, customizable height, adjustable handles, and a modern look into a commode that addresses each user pain point.
The adjustable and fully retractable armrests and the large seatside platform help users transfer safely and independently. We also brought back the feel of a normal toilet. So we have a large, soft, oval-shaped, and pinch-free seat to prevent skin wounds and improve comfort. We added front and back seat cutouts to improve access for wiping and to accommodate male anatomy. We also incorporated a hand pump bidet and toilet paper holder to reduce risks and inconveniences traditionally associated with wiping for both users and caregivers. So as you can see, height is adjusted by pulling the handles outwards and lifting to the user's desired height. The armrests are raised once the lid is open. And looking inside, we can see the self-contained bidet system operated with a simple pump action. And the bucket features a sealable lid that ensures spill-proof disposal. And when not in use, the lid is stowed underneath the seat where it is safe from becoming possibly contaminated.
Commodore gives users a sense of empowerment, less reliance on caregivers, and a better quality of life. The beautiful design integrates into modern home settings, eliminating the stigma associated with traditional healthcare equipment. We showed our design to stakeholders and have received overwhelmingly positive feedback. Thank you.
Okay, thank you very much. Next up, we have a team that has been working on an opioid overdose response kit called On Hand, and they're up next.
All right. So we designed, our product is called On Hand, an opioid overdose response kit. We, over the course of our investigations, expanded it to be just a general overdose response kit, not isolated to opioids. However, opioid overdoses are the sort of epicenter of the pandemic of overdoses we see in this country, especially poignantly seen in Philadelphia. And so we asked ourselves, is there any sort of role that healthcare students in general may play that is not being tapped in responding to witness overdoses? We view urban centers as a site of higher density of overdoses and also higher density of healthcare students. So could this be an untapped resource? This is us. This is what we've done. As I said, the problem is overdoses, and most of them can be readily reversed if somebody steps in. So we wanted to look at, is there a way that we can decrease the barrier of entry for individuals to feel comfort stepping in and helping to reverse an overdose or respond? We planned a design. We wondered, can this question be answered with a design solution? And through our investigation, we would go and do a survey to ask first if there are barriers for, like, if somebody would respond. If their answer is low on the yes, I would respond level, what's keeping them from doing so? What are the factors that would make them not feel safe or not feel comfortable stepping in? And through that survey, inform our design decisions.
Yeah, so for our methods, kind of like what Matt said, we were prototyping mainly. So our thought was if we had a sleek, portable case that fit in the student's bag or any kind of healthcare worker's bag that had everything that they needed, that would lower that barrier to response. So the things that we considered were at least 2 doses of naloxone or Narcan, more if it fit, a few sets of protective gloves, facial masks, bandages for a needle stick injury, and possibly a ventilation mask, though the data on that goes back and forth. Our goal was to design a survey, like Matt said, to test these prototypes and see if that would make people more likely to intervene. So here's a few design concepts of things that we'd seen in the past. There isn't surprisingly a whole lot out there now that really addresses everything. You can get just Narcan or just the other stuff, but not everything altogether. So we looked a lot about things that fit in backpacks like water bottles or like lunch boxes or pencil cases.
So in our mock-ups, we thought we should have those individual like tool supplies, and we should also have the supply of knowledge. And so education is something we view as integral to the comfort of individuals to step in. And so we looked at mock-ups that would be something that could go unobtrusively into a backpack. The first thought was something like an iPad that would slot in next to binders. And then we also thought of something like a water bottle or an umbrella. Built into the design is some sort of pictographic, stepwise how to use that isn't going to require a ton of going and reading through it, but would be like just readily this done instructions.
So here we're showing off a bit of our physical prototyping, moving from like 3D images on paper to actually creating like 2 physical options. So as we talked a little bit about before, we wanted it to be like a convenient option to add to your day. So we were considering like a laptop shape, so it could just simply be like placed in your bag like any other book, or maybe like a thin cylinder option, more like an umbrella. We have both of these drawn up here, where you can see like the stepwise discussion in the laptop shape. Or if we were going to go with the umbrella shape, they would kind of be pulled out in sequential order, kind of just helping to simplify the whole process, making sure that our user feels comfortable. So this is our visual abstract. Moving through it, the education has been shown actually not to increase positive results of Narcan, but it does significantly increase the use of Narcan. So just making sure our user feels comfortable with helping out through education can definitely make them more likely to use our product, which was our end goal. And then when we talk about preparedness, we're referring to the equipment in the kit, including like the Narcan, the gloves, the mask, and this serves to not only protect the user, but also to make them feel, once again, more comfortable helping out, which can be the biggest barrier to entry. And then, as we discussed before, convenience is very important to us. If it's not easy to add to your life, people aren't going to add it to their life. So either a water bottle shape, potentially a laptop, an umbrella are all valid options that could simply fit into someone's daily bag and make it possible for them to carry around and help someone out, hopefully. Thank you.
Thank you very much. All right, our next team up, I believe, is Stability Sidekicks, who are tackling preventing falls. Yes. Okay, I will do that. Who's got the clicker? Make sure you look pointed in that direction.
This thing's on. Yeah, really close. Yeah, okay. Okay, hi everyone. We are Stability Sidekicks, and we're here to talk about our fall risk assessment tool.
I'm Barbie.
I'm Justin.
I'm Jeremy.
Lily.
So I want to start talking about my grandmother. So she was one of the most independent women I knew growing up. And in fact, she was a nurse. And when she retired, when she wasn't spending time with me and my brothers, she was actually traveling a lot in her community and also even internationally to go help people with all of their medical needs. And then she started falling as she got older, and her balance wasn't the same as she got older, and then she started to fall. And then her health just started to decline from there, and she was never the same after that. And why is that important? Well, my grandmother's story was just one of nearly 750,000 annual hospitalizations that are caused by falls out in the community. And all of these falls contribute to a cost of nearly $19 billion that accrue on the medical system annually. And the real problem is that over a third of these falls, like my grandmother's, are preventable. So the issue at hand is that when patients are at high fall risk, ideally, you would send a PT or an OT to evaluate their home and give them recommendations on what to improve. The reality of the situation is that, unfortunately, it's often really difficult to organize this visit with a PT or an OT because of insurance being difficult or the cost being difficult. And so the paradox at hand is that only after a fall has happened will insurance usually agree to cover a PT or an OT visit. And our question is, how can we increase accessibility to fall risk evaluation in patient homes? How can we make that process easier and better for everyone?
So our solution is, what if you could get a personalized advice from your device? Basically, could you take an iPhone and take a picture of a room and then get personalized, accurate information that you could use to prevent falls? So we decided to implement a large language model, which think of ChatGPT, and we had to perform several steps to make sure that the model actually performed what we wanted it to do. So first of all, we did custom prompting using XML, basically making sure that our model responded in structured responses. We wanted like the same elements in each of the responses. We also messed with some of the parameters, specifically temperature and top P, to get reliable responses. We wanted the model to always go back to what it knows. Second of all, we uploaded trusted evidence-based guidelines that the model could base its responses off of. Specifically, we used the CDC study database, which improved response reliability. Finally, our model is multimodal. We built this off of Gemini 2 Flash from Google, which means that it can accept a variety of inputs, specifically photo, video, audio, and text. And it can also respond to users in multiple methods, text and audio. But there's a lot of talk, so let's actually see how it works. Video. All right, let's see. Let's hope it works.
All right, bear with me while I switch audio 1 second.
Yeah, so as you can see, the user is now going to show a video of the room, my bedroom, no, that's not. And then once the user shows a video.
This room appears to have a medium risk of falls. There are a few things that could increase your risk of falling. First, the chair has wheels, which could roll out from under you if you are not careful when sitting or standing. It may be safer to use a chair without wheels in your bedroom. Second, the blanket on the bed hangs down to the floor, which could become a trip hazard. It would be best if the blanket was not long enough to reach the floor. Finally, there may be a power cord near the desk, which could also cause you to trip. Make sure you check the floor often and pick up any power cords. If you make these changes, your room would be safer. Do you have other questions about your risk of falling?
To identify future falls.
Show that the model was able to detect, identify a picture, detect, and then move forward and give specific responses. Yeah. All right, and this is just a photo version of what we just saw. Yeah.
Right. So as you can see, our assessment tool focuses on 3 core competencies. The first is accessibility, whether it be the type of device that can be that can access the internet, as well as the type of input modalities. The second is we wanted to be successfully be able to generate a evaluation that is both accurate and up to date with the recommendations. And third, we wanted it to be speedy because no one wants to wait for a really long response.
So next steps for our project include further testing to see how it kind of acts in a variety of environments and including moving to production. So right now what you're looking at is like applicable for an iPhone, but what about tablets and other devices? We also want to test its kind of reliability against the standard of care, which is PTs and OTs visiting the patient's house. And we want to conclude some user testing and validation. So ultimately, stability sidekicks can serve as a tool to reduce fall risks with potential applications to enhance fall risk assessments and to help older adults in making their environment safer. Thank you.
All right, thank you. You can. I encourage them to do a live demo. I know it's always risky during these, but I wanted to see that thing actually tick. All right, our next team is Team Heal Up. All right, here you go. Make sure you point it at your face. The clicker. You guys feel the clicker?
All right. My name is Samuel Ashmagun.
My name is Haig Manukian.
My name is Rabiul Rafi.
And we are Team Heal Up. So Heal Up is a modified crutch with a built-in leg elevation system designed to help those with lower limb injuries alleviate any pain they may have from swelling. So the idea for this product came from a personal experience I had. So I was playing basketball and ended up injuring my leg. And after this injury, I was in a rehabilitation state for around like 6 weeks. And it was during the 6 weeks that I found it very challenging to adequately elevate my leg in a lot of public environments, such as like lecture halls or bus stops. And this was mainly because I didn't have the correct tools to help me elevate my leg. So once I joined the design track, I decided to work on a solution towards this problem.
So Sam's story likely represents one of many cases in the U.S. We have 141 million ER visits in the U.S. per year, and 15% of them are for lower leg injuries, many of which require crutches. And one of the primary problems that these patients report using those crutches is that they experience lower leg swelling, and it's very painful. And the mechanism behind this is pretty intuitive for us. As we walk, our muscles contract the blood vessels and pump that blood and fluid up to the heart. But for someone who's immobilized, that's not very possible. So we were trying to, with that in mind, we looked at a framework and we saw that patients will have lower leg injuries and they'll see their doctor, go to the ER where they'll be prescribed crutches, but they may experience discomfort when flexing the knee due to that swelling. So we wondered, how can we maintain the leg elevation?
So initially, patients with lower leg injuries might kind of intuitively try to raise their leg in public settings using objects that are around them. Obviously, this relies on the environment to have these kinds of objects. So that's where we wanted to step in and kind of create a device that gave these patients an object wherever they might go in public places to allow for that leg elevation. So our initial research consisted of looking at crutches that were already on the market that had some kind of modified kind of system. And so we found some canes that allowed for patients to sit. We also found some crutches that allowed for the knee to be in the flexed position, but none that allowed for elevation in the extended position that would allow for patients to alleviate their pain from their lower leg injury. So this led us to our initial prototypes, all of which allowed for that extended leg position elevation, but none of which allowed for stability and or mobility, which were the kind of two main criteria that we were most interested in providing for these patients. So this led us to our final prototype, which involves a kind of modulatory crutch system that shifts from crutch mode to leg elevation mode seamlessly. So we have a video demonstration of our prototype here. So you can see Sam is sitting and transitioning the crutch to the leg elevation mode, elevating his leg while seated, and then transitioning to the crutch mode as he stands up and uses the crutch to help him walk. And there he is using the crutch as kind of a traditional crutch. So here's some schematics of our design. So here again, you see the person using their crutch in leg elevation mode, and the crutch can shift from its various modes, again, seamlessly to allow for mobility and accessibility for the patient. And it's also quite compact as well compared to a standard crutch. Here's our visual abstract. And thanks so much. We'd like to also thank the folks at Delve Design Firm and East Falls campus, as well as Rob and Mary Ellen and everyone else at Jefferson who helped us along the way.
All right, thank you. Great job. All right, the last team up for the design track is integrating digital avatars. They are tackling something called medication ambivalence, which is near and dear to my heart as a pharmacist. And it's a term that I didn't even know existed until they told me about it. So hopefully you get educated as well. So remember, hold it close like this and point the clicker kind of behind you. Give me a second to switch your slides.
Good afternoon, everyone. My name is Josue.
My name is Suji.
And I'm Beth Ann.
And our project is titled Interactive Digital Avatars to Reduce Medication Ambivalence and Support Wellness. And we have no disclosures. So I'm pretty sure you have seen this meme before, and I'm pretty sure a lot of you can relate to it. But I just want you to imagine putting yourself, I don't know, in the shoes of someone, say, with major depressive disorder, who not only struggles to find the motivation to just do all of this in their personal life, but to even curve the ambivalence of taking their daily medications. especially in that critical 4 to 8 week period where someone is initially taking their, say, SSRIs. So we present you with a potential solution.
So they have all these problems, right? And they might be starting a new medication, but they're not going to take it. So how can we help them motivate themselves to take their medication? So introducing anima fruits. And you might be asking yourself, what's that? Well, let me tell you. We have these two elements, right? We have an animal and a fruit. And who doesn't like both? So we thought we could just combine the two. Because these two things combined in us evoke joy within ourselves. So we wanted to see if we could do the same with others. And by doing so, we hope to replace feelings of ambivalence with delight and that same joy. And then from there, we have, how can we take this a step further? So we have this anima fruit that's supposed to help you with your daily goals, but how are you supposed to want to continue doing that if it's just this anima fruit? So we thought of introducing broccoli llama. It's one of our other animals, and broccoli llama has this element of evolution. Think back to like your Pokemon days, where the evolution helps you helps motivate you and reinforce the positive, helps integrate positive reinforcement. And that's going to lead to that long-term behavior change.
And so our next step was to gather some feedback about our initial idea. And so this was with the assumption of 3 key ideas. 1, the fruit theme is appealing. 2, the attachment to the back of the phone is more desirable than, let's say, an app that just clutters your home screen. And number 3, the evolution of the avatar, as Beth Ann just said, is leading to positive reinforcement and hopefully long-term behavioral change. So with that in mind, we asked 5 questions to 14 peers. And those were questions like, what do you think about the back of the phone design? Is the fruit theme adding value to your user experience? Would you actually use this product? Would you use it daily? And would you change anything about the product? So based on that, this word cloud depicts the most commonly repeated words that was within our feedback. And these are things like nouns of phone, idea, animal, app, but also generally positive adjectives like cute, great, love. So in general, we take this as beginning to validate our 3 key assumptions and moving forward.
So this just kind of shows our future plans, which include our goals for long-term adoption and efficacy, redefining our target audience, and weighing the pros and cons of the form factor of our product. So in summary, our key question is, how might we create an intervention that reduces medication ambivalence to support the wellness among adults aged 18 to 40 with mood disorders? And we are going to accomplish these, we're going to accomplish this with these 3 aspects. The first being using customizable avatars with corresponding goals.
Our second goal is to have some sort of interaction to help promote engagement and long-term behavioral change.
And the third factor is the meaningful form, meaning the user interface and how it is both portable, accessible, and hopefully integrated into daily life, leading to a convenience factor. And that's it. So we wanted to thank Dr. Kay, she's a psychiatrist here, for her input on caring for young adults with mood disorders. Mary Ellen, because she always gives us snacks. There's some over there. Keeps us on track and is always supportive. And then the 14 peers who gave us feedback, our SI mentors, and thank you all for listening.
Okay, so that concludes the design track presentations. Thank you everybody online for tuning in. We're going to be